So you mentioned the whole person approach, and that brings me to another question I wanted to ask you, and that's the watch and wait approach, which you discuss in the book. Can you tell us more about that?
Yeah, this is not so much radical as it's simply not been used. And watch and wait means that you basically take your time to make a formulation, a case formulation. Doing nothing is doing something, and watching and waiting kind of takes away that press to do something immediately. The errors that I saw with older folks at Robert Wood and to some extent MCG and other places in the country were ones in which we shot from the hip very quickly for good reasons, but often what occurred was there was a dance that ended in dosage failure with medication, with not follow-up, with inappropriate case formulation. And watching and waiting seems to make so much more sense with older adults as you begin to look at the models of what's important. And you're not doing nothing. You're setting the stage for what needs to be done. And so I isolate core criteria in there of assessing and validating the person and monitoring and making sure that there's a good case formulation that unfolds here and building up an important alliance with not only the patient but the family. And the model allows you to do that with some time because it's sort of part of the scaffold and structure of what the model suggests.